So if you mood stabilize, what happens to sleep? Patients who are on antidepressants complain of disrupted sleep. As part of the diagnostic criteria of depression, insomnia is one of those criteria. Nocturnal insomnia is the most frequent residual symptom of depression. So it's very important that in all ideal circumstances, antidepressants should actually normalize sleep. But in short-term treatment, it actually might disrupt sleep. As we said, it shortens REM sleep. So even though you might see an acute effect, you must watch for the, again, treatment-emergent mania issues like decreased need for sleep, not insomnia, but decreased need for sleep to differentiate a treatment-emergent or antidepressant-induced mania. And you also must understand the ways in which antidepressants can cause sleep disruption as a side effect. It can induce sleep, but it can also induce insomnia. For sleep promotion, some people have suggested using antidepressants as part of CBTI. The bottom line here is that if you've documented a manic episode, mood stabilize first before you go down the path of using an antidepressant to address or modulate sleep, because you've got to do that first. There isn't any circumstance where I would ever have a patient with mania on just an antidepressant alone.